Hi people, how are you doing? After a long time, I'm shooting a video. So, I'm just sharing my experience and journey regarding I just started preparation for ADC Part 2. So, when I cleared my ADC Part 1, I was like relaxed, you know what, let's go ahead and give the exam after like 1.5 years because my son is just like 5 months now. I was like, let's chill time with him because when he was being born and I was still like, he wasn't born. I was just busy studying for ADC Part 1, and I'm sure a lot of people of this age group between 30 and 35 will be going through this something or the other. So, yeah, so the result came, and in my previous videos, like I've mentioned, my journey to ADC Part 1. So I thought, okay, fine, let's give after 1.5 years, absolutely oblivious to the fact as to what ADC Part 2 is about. So let me explain for all those people who are going to give ADC Part 2 or want to know what ADC Part 2 is all about. The exam is of 2 days, and the ADC prides itself in mentioning that it's one of the most toughest dental exam. And after looking and going through the course, I'm still in the course right now for ADC Part 2. It's so tough. I'm not saying it can't be done, but wow, there are days when I just want to give up. I'm sure you will also have one of those days, but don't give up because there is a reason why you're doing, right. But yeah, it's mentally and physically exhausting. So what is this exam all about? So it's a 2-day exam. Day one is technical skills. So what are these technical skills? One, so it's divided into two parts, preparatory and restorative. Now, when I say preparatory, it means you will be given a tooth number and you'll have to prepare it for a PFM crown, that is porcelain fused to metal crown. I understand nobody in the world does this anymore, I guess. Everybody shifted to zirconia and minimal prep, but yet ADC wants, and that's how it is, and that's how you'll have to be. Now, the problem is the way you prepare the tooth, it's going to be graded on around 15 criteria, which the ADC has mentioned in their booklet. But 15 criteria just for one tooth. So you have to be very, very precise. You'll have to, practice and practice over the tooth. Now, it's not just one tooth that they can ask, they can give any tooth number, but mostly they choose to give molars or the canines, the upper ones, and they are very difficult to prepare. I've just prepared 3 of them, and I'm making so many mistakes myself. I'm not that great in a PFM technical screen on a mannequin, but yeah, with practice I'm improving every day, but yeah, it's tough. So yeah, first task is the preparatory of the crown, PFM crown. Second is an endo preparation. So you have to make a RCO opening, and they have the specialized teeth which have like wax inside them. So they simulate as if there is a pulp, and you have to make sure that it's within the defined criteria, which is not more than 2 millimeters either way, 2 or 2.5 millimeters. You understand what is 2.5 millimeters? It's nothing, like nothing. I mean, you cannot overextend at all. Your outline has to be just perfect. The entire cavity width from one end to two end may not be more than 3 to 4 mm, and you may have 1/6 or 2/6 in the exam that you would be asked for, and you have to de-roof it, and there is these teeth are prepared in such a way that it's so difficult to de-roof the entire thing, because a slight gauging or something may happen. But yeah, that's how it is. You have to practice. So that's the second task. So the first is PFM crown, second is the endo, third is a cavity prep. They'll give a tooth which has caries. Yes, there are specialized teeth, which I also came to know that the ADC prefers, and you have to prepare a minimally invasive cavity as if you're preparing for a composite. So these three are the preparatory tasks, and the other three are the restorative tasks. The first being preparing a crown with pro temp over the tooth that you prepared. The crown has to be perfect, no voids, and within their 15 graded defined criteria. Then the second task is of composite. Composite can be on a molar, a complex cavity, or on the anterior, a class 4. So again, they have a defined criteria. It has to be smooth and with its anatomy, blah blah blah. And the third one is amalgam. Yes, who does amalgam? No one. But yeah, you have to. So the amalgam will come as a complex cavity. Complex means one cusp is missing, the contacts are broken, you will have to build them. And again, yes, you have to be within the defined criteria. So they will cut the tooth and give it to you. Like they'll prepare a cavity which would be machine cut, which means it's so smooth that your restoration won't stay. So you have to, put ditches and grooves on it to give it additional retention. So we'll talk about that in a different video. So this is day one, guys, and they'll give you 6 hours, and you have like complete infection control protocol. I'll speak about in detail about the infection protocol. I just learned it today myself, like what the ADC wants. It may not be necessarily the thing that you're following in your clinic. So basically, the part 1 day of the exam has got nothing to do with your clinical skills. Meaning, even if I think I teach my mom for 6 months that you take this tooth and prepare this way, and if she practices, she'll be fine. So you may be an experienced practitioner, you may be an endodontist, you may be a prosthodontist, you may be a general dentist with like 20-30 years of experience. When you'll be given this task as a first time, I'm sure you'll fail, because it has to be prepared in a certain way that I don't think so anybody follows anymore. And it has to be that way because that's the criteria for the ADC exam. So for the first 2 days, when yes, you have to take a course, because there is no way you can learn by yourself, all these things. So I had to come to India because that was the closest place where I could for the course for a short duration of time to learn as to what to do and how to do it. Why you have to take a course? Because you're going to practice on teeth, and these teeth, oh my god, they are like gold. They are so expensive. Apparently online, unless you're buying from a previous candidate, only Navdha Dental that I found sells it, and One Dental from Australia. Navdha is from India and One Dental is from Australia. So Navdha sells one endo tooth. Endo tooth means the tooth on which you'll prepare your RCO opening, for like $24, one tooth. And of course, you'll need at least 20-25 teeth to practice before your exam. One carious tooth is like $15, and again, you'll need the same amount of teeth to practice. And the rest of the teeth are like $1 or $2 each. I'm talking about US dollars, not Australian dollars, okay? So US dollars, and the normal teeth, when I say, you need at least like 100 of them. Yes, I'm not kidding. You need like 100 of them, because you'll practice 10 on this molar, 10 on this molar, and when I say molars, it's 6 and 7 both. Anything can be asked. So 4 teeth in the lower jaw and 4 teeth in the upper jaw. So bang, 80 teeth there. Canines, again 10. So like 100 teeth like this. So yeah, you'll be practicing somewhere around on 150 teeth or something. Now multiply that by the dollars that I've mentioned. So the jaws itself are like $400. The mannequin and the Fletcher are a different cost, and all the different materials that you would need to practice. So a huge expense, guys. Expense is one part. The amount of time that you'll have to devote. One tooth preparation, when you start as a first timer, it easily takes somewhere around 1.5 hours. So imagine you're having an 8-hour clinic and then 1.5 hour of practice. The thing here is you need to learn how to prepare this teeth. I mean, you may be, like I said, the most experienced clinician ever in the history of mankind. But that tooth and that burr and their dimensions, it's like totally something else. So you need to have a proper control, and the angulation and the width and this and that. You'll have to devote daily time if you would like to clear the exam. So, yeah, this is the day one of ADC. Day two is performance OSCEs and the communication OSCEs. Now, communication OSCEs at 6. So, what they'll do basically, you will be ushered into a room where there would be a screen and they would give a question. I'll give you an example. Say, a 47-year-old Mr. John is taking hypertensive medicine and is also having some kidney problems and osteoporosis and gum problems and other complications. And he's having pain in his lower molar. You need to diagnose and manage the patient. So, out of the six OSCEs, they are divided into three clusters. One would be information gathering, which they would mention in the question. The second cluster would be diagnosis and management, which is the longest cluster, but still you'll have 10 minutes only. And the third would be treatment planning. So you'll have 10 minutes, and two examiners would be sitting, and the question would be displayed on the screen. You'll have 2 minutes to read the question, and you can write notes about whatever points you would like to save as your answer. And then the examiner who's going to grade you would be sitting with a tablet and would be ticking on whatever you are answering, and the second examiner would be acting as a patient. So the first examiner who's grading you would check how you approach the patient. Are you showing enough empathy, appreciation? Are you asking the right questions related to the question? Are you able to explain the diagnosis in the non-technical terms, like the layman terms? Like, you cannot use terms like you have a reversible pulpitis directly. You'll have to say that there is, infection in the nerve of your tooth, or you just cannot say palate. You have to say like the roof of your mouth, or things which a normal person would understand. So there is whole set of like 600 pages for OSCEs, and different sorts of conditions, and how you present yourself and the confidence with which you present yourself. So those are the performance OSCEs for which you need approximately 3 to 4 months to prepare, and I would recommend take a mock test through a mentor. I've just started reading the cases. I'm just solved 6 or 8 so far with the people I'm taking the course through, and I'm getting a hang of it. I'm just like 20% through, like, in understanding what the exam pattern is. It's a long journey. It's a really long journey. ADC. How much time you need to prepare? Minimum 6 months. Like, you cannot appear before that unless, I don't know, you're some extraordinarily exceptional candidate. So that's day two, first part. The second part is performance OSCE. So all these things should be finished in 3 hours. What is performance OSCE? Performance OSCE means there'll be 4 of them. So total 10 tasks for day two. 6 communication OSCEs and 4 performance OSCEs. So performance OSCEs, basically they'll ask you, you'll go in a room and there'll be this mannequin and the stuff is kept, and a question would be like, oh, apply rubber dam to this tooth number. So they will grade you on how you do infection control, and we'll talk in detail about that. And how you place the rubber dam, and you'll have the time as 10 minutes only. So you can have rubber dam, pit and fissure, extraction, LA, that's give local anesthesia to the mannequin, and medical emergency like perform CPR or some other kind of thing. So there are like 8-9 performance OSCE things that you need to know, out of which 4 can be asked. So this is day 2 of your Australian exam. Now, how to go about it? So when I cleared my part 1, like I said, I was like chillaxed. Next year we'll apply and this and that. But then, because COVID was there, and a long time the dates were blocked, and they suddenly opened up, a lot of candidates are applying, so you may not get the dates easily. So I'm not an Australian citizen. I'm an Indian citizen, and I also heard through one of my friends. Heard as in I spoke to him. So this guy had prepared everything about his exam, had booked his tickets, and he got the exam dates. But his visa did not come. It got rejected due to some reason. So I was like, what am I supposed to do? Like, book the exam dates, start preparing, apply for the visa, because visa is not something that comes in 1 or 2 days. And how to apply for the visa? So I applied through tourist visa because that's how everybody applies. A lot of people told me apply through an agent, but the agent was charging somewhere like 40,000 rupees, or I would say 2,000 dirhams. I was like, no way, I'm paying this much. It's too expensive, man. So one of my friends who stays in Australia told me, why don't you go to the Australian website and apply? That's how they apply when they call any of their relatives. So I went on the Australian website. If anybody wants the link, just message me. I'll write it in my description. Right now, I'm just about to sleep, so I'm not writing anything under description. I'm just talking, and I'm going to post this video. Um, yeah, I went on the website, and it took me like 2 hours to upload all my documents. They were asking my travel history, my bank accounts, and where all places I had visited, why I want to visit Australia. I mentioned I want to come as a tourist and appear for the ADC exam. I mean, frank and honestly. Uh, and I don't intend to stay more than like 20, 30 days max. And I do have few friends and friends, not family. I have some friends in Australia, but I'll see if I want to visit them or not. So, plain and simple description I wrote and I submitted. So immediately I got an acknowledgement. Yeah, I had to pay some fee, some, I think so, 190 Australian dollars or something. Uh, Immediately I got an acknowledgement that they had received my application, and I have to go for my biometric evaluation, that is giving my fingerprint. So I went to VFS Global in Dubai. After 16 days, you have to take an appointment for that. So whichever country you are in, you'll have to see if the biometric, where it is done. I gave my biometric on May 16th. Now they mentioned that it takes around 37 working days for the visa to come, and there is absolutely no way that you can check by means of calling a customer agent to anyone, because I did call in the month of July end. So May, June, July. I was like 37 days are over. My visa should come. It's not come. So July end somewhere. I called up their customer care number, and the person who picked up the call, heavy Australian accent, he said, I'm sorry, I can't do anything. You just have to wait. And it's also mentioned on their website, it's no point calling any of our customer agents. You just have to wait. So I just waited, and just as July was ending and August was starting, I got an email saying that my visa was approved. So the thing is, the Australian visa is valid for 1 year. And the ADC part 2, after part 1, you can give only in the next 3 years. So, and you have like 3 attempts only to give. It's not like you have unlimited attempts. So now I was in a fix because I was planning to, try and start preparation next year. But now, so then I was like, okay, what to do and how to go about it. So wherever I searched any course that was teaching part 2 things was minimum for like 4 weeks. I'm like, hell, no way I can stop my clinic for 4 weeks and go away from my family and practice 9 hours a day. So I kind of requested one of the people, and one of my friends suggested, and I told them, just try and cramp up in 14 days and just teach me. The practice part I'll do at home, back home, just teach me at least the basic things. So here I am on my day 8 out here. I came here last Tuesday, today is Wednesday, and wow, first 2 days I was so thoroughly demotivated. I'm saying all this because if you're going to go through the same, it's okay. It happens to everyone. And I'm pretty strong that ways with my willpower, but still I was so demotivated. I'm like, why am I doing this? Because what frustrated and annoyed the most was this nobody does in the real world. Who prepares VFM crown? Who does amalgam? Nobody does it. And that too, such minute grading criteria as like it should not be overextended by 0.5 mm. It has to be rounded off there. I mean, it looks good. It does all the function. No, but you want it in a specific way because there are 15 grading criteria. So, but yeah, so day one, I was just moving my bird like how you do in your practice. No, I realized it has to be done extremely slowly. You have to press the air rotor like at half the speed, and you will discover your own ways, and depending on the mentors, how they are teaching you. Uh, so yeah, that course fee is another thing. It like huge amount of expense on that. So yeah, that's about my ADC part 2 journey, which I've just started, day 8 in my journey. I'm staying as a paying guest in somewhere in North India. The people are really nice out here. I feel homely, like you can see, like whatever you can in this video. Um, homely people, but still I miss home. Yes, I do. Sacrifices for ADC part 2. I'm sure you will be having your own story. If you have passed in first attempt, do share. Passed in second attempt, passed in third attempt. Not passed, it's fine. It's fine. This is not your clinical skills grading, and it's a tough exam. So share your stories, motivate other candidates. I'm just sharing what I've learned so far about ADC Part 2, just basic understanding the framework and the guidelines of it. I'll keep on posting videos as to about each task or something, especially the infection control guidelines. So let me know how you feel about it, and share your experience too. Bye bye.